Good morning. I'm Dr. Dean Sidelinger, the State Health Officer and State Epidemiologist at the Oregon Health Authority. Thank you for joining us for our latest update on the state's continued response to COVID-19. This is OHA's second monthly media availability since we announced our priorities March 11th for the next phase of our pandemic response. Our framework, the RISE plan, or Resilience and Supportive Equity, prioritizes protecting people at highest risk and continues our partnership with our communities to advance our work to eliminate health inequities across the state. Let me acknowledge that all of us are ready to move on from COVID, but unfortunately the virus continues to spread throughout our state, and there are some steps each of us can take to protect ourselves and our loved ones. We can support our neighbors who are recovering from COVID or battling long-term symptoms. We can grieve with our fellow Oregonians as many continue to lose family members and friends to this horrible disease. Today, I will highlight our latest data and OHA's ongoing efforts to keep Oregonians informed and safe, including through access to vaccines and boosters, as well as therapeutic treatments. First, the state maintains measures that protect Oregonians, including our most vulnerable residents. State vaccination requirements remain for those working in healthcare settings, congregate care settings, and K-12 schools. Mask requirements also remain for healthcare, long-term care, and other congregate care settings. It's now been more than 2 months since statewide indoor mask wearing requirements were lifted outside of those settings above. With spring's arrival, many of us are resuming the activities we enjoyed previously, such as traveling and gathering with friends and family. This also means we are increasing our chances for exposure, particularly indoors. Our surveillance also shows that the predominant strain in Oregon, Omicron variant BA.2, remains highly transmissible and widespread statewide. Like its predecessor, the Omicron variant BA.1, it is a stubborn adversary. Around the country, as in Oregon, we are seeing rises in new cases and hospitalizations caused by BA.2. Unfortunately, these developments tell us that the pandemic is not yet over. If you're in a gathering of people outside your home, sooner or later, you will be exposed to the virus. This could be where you worship, where you work, where you recreate, where you shop, or where you connect with friends and family. The risk of exposure and infection exists in every Oregon community, and we see that in our statewide data. In the 4 weeks since our last update, test positivity has risen from 7% on April 20th to 11.4% on May 16th. During the last month, daily reported case counts more than doubled as well, from a rolling 7-day average of 600 cases a day on April 20th to 1,350 reported on May 16th. And we also know that most cases are not being reported to public health, both because testing is occurring at home and because some individuals do not get tested. So our state and national trends all tell us significant disease transmission is occurring. Recent data shows a slowing of the increase in reported cases, indicating we may be nearing the top of this current peak. OHA is optimistic that the overall number of Oregon's hospitalized patients with COVID-19 will not exceed our hospital system's ability to care for them. Since our April 20th update, hospitalizations have nearly doubled from 110 to 251 COVID-19 positive patients. Modeling from Oregon Health and Science University and the team led by Dr. Peter Graven project that the number of COVID-19 positive patients in Oregon hospitals will peak at around 321 on June 10th. This is less than a third of the number we saw during the Delta and Omicron waves, when we experienced peaks of 1,178 on September 1st and 1,130 patients on January 27th, respectively. OHA continues to watch COVID-19 hospitalizations closely and to support our state hospital system. If required, we would be ready to respond to any future surges. OHA and our partners continue to track the new subvariants, such as BA.4 and BA.5. Evidence suggests our existing vaccines and the level of vaccination and previous exposure to the virus will still provide significant protection to prevent severe illness, including hospitalizations for most people. I also want to discuss the school advisory that was sent last week to state K-12 educators by the Oregon Health Authority and the Oregon Department of Education. This was to ensure that schools can operate in person through the remainder of the school year. As of last Friday, with 6 Oregon counties listed at the mid-level risk according to the CDC's community level system of low, medium, and high risk, OHA and ODE encourage schools to continue using layered mitigation strategies. This includes recommending face coverings or considering their universal use before making any decision for remote instruction or to end in-person instruction. In addition, OHA and ODE recommend that anyone may choose to wear a mask because of their individual risk level, such as the risk of severe disease or having family or community members at higher risk for severe disease. We also suggested schools continue using free COVID-19 testing programs for student and staff across their campuses. In addition, our local public health partners are continuing to inform their residents about COVID-19 trends in their area. Last week, Multnomah County recommended its residents consider wearing masks for the next few weeks in school, work, and other indoor settings. Finally, I want to address concerns of those at greatest risk. Residents at high risk of severe illness from COVID-19 will face greater challenges, even if they have been vaccinated and boosted. Those with underlying medical conditions or who are immunocompromised should consider contacting their healthcare providers now to make a plan to get tested and receive treatment should they become ill. People who don't have a healthcare provider can contact their local community health center or call 211. OHA strongly encourages residents with these risk factors to minimize indoor social gatherings, and we recommend wearing masks in these social settings and choose the highest quality mask that fits them well. Medication is available in many pharmacies and clinics for treatment of COVID-19 in people at increased risk for severe disease. Treatment should start within 5 days of symptom onset to be effective. That's why we say those at increased risk should plan now for where they will seek care and get treatment if they develop COVID-like symptoms, including cough, sore throat, or fever. That way, they can get tested and start treatment quickly if they have COVID-19 infection. This will help to prevent them from needing to be hospitalized. You can find out where these medications are available on the federal Test to Treat locator that can be found on our COVID-19 treatments webpage and at our website, covid-19-test-to-treat-locator-dhhs.hub.arcgis.com. I'd like to thank our many partners and providers who continue to serve residents as we deal with the latest changes. Thanks also to all Oregonians for taking steps to protect yourselves, your families, and your coworkers and neighbors. If we each take steps to protect ourselves and our loved ones, COVID-19 does not have to dominate our lives. Being vaccinated and boosted is the best way to protect ourselves from severe disease. Some of us will continue to be more cautious because of our own health or the health of the people around us. So let's support each other as we move through this phase of the COVID-19 pandemic. And with that, I will now take some questions.
Thank you for that update, Dr. Sidelinger. A friendly reminder to our media friends to please include your news outlet with your name, and that helps us identify who you are. I put this in the chat, but if you have a question, feel free to raise your hand. And our first question comes from Lillian. Lillian, go ahead.
Hi, I'm Lillian Manja-Hughes with OPB. Thank you, Erica. Dr. Sidelinger, my question is, are we at a point where it's reasonable to say everyone is probably going to get COVID now that Omicron is so contagious with these new variants?
Thank you for that question. I think we're at a point with the most recent Omicron peak led by BA.1 and now with BA.2 that we're all going to be exposed to COVID-19. Wearing a mask consistently in indoor public places and limiting those gatherings will reduce our chances of getting COVID-19, but almost all of us, as we leave our home and enter these places, are going to be exposed to this, and these variants are highly infectious. That's why the mask protects you from that exposure to being infected, and then vaccinations and boosters protect us from being hospitalized. But yes, the reported numbers that are high right now represent just a fraction of the COVID-19 in the state. And yes, leaving our home, going to church, going to school, going to work, gathering with friends does lead to increased exposures, and those simple steps of wearing masks, moving activities outside, and being vaccinated and boosted help protect us and the loved ones we return home to.
And just a quick follow-up, what do we know about the incidence of long COVID with Omicron variants?
I think what we know about long COVID is as much as we don't know about long COVID. There are varying estimates of who is impacted by long COVID, depending on whether we're looking at patients who are hospitalized with severe disease or the general public. But we know that it is a fairly common occurrence, that people will have symptoms, whether children or adults, for some time. And we don't see any evidence that the incidence of long COVID following our Omicron subvariants is any different than following previous variants. So this remains a concern for those who are ill with COVID, that they could have ongoing symptoms. The good news is that being vaccinated and up to date with COVID-19 boosters seems to offer protection not just against severe disease, but limit people from getting long COVID. So that's another reason to get our vaccines and keep our status up to date.
Thank you.
Thank you for those questions. Our next question comes from Paulina Aguilar with KPTV. Go ahead, Paulina.
Hi there. Thank you for taking my question. My question is, where do we stand with getting third boosters? A lot of people haven't had a booster since last year, and with cases going up, is this something that people should start, making an appointment for or looking into, or are we kind of still just waiting on that right now?
Thank you. Let me talk a little bit about where we are with booster doses right now. For everyone, whether they got a single dose of Johnson & Johnson or a 2-dose mRNA vaccine, our older children and adults are eligible for a booster dose at least 5 months after you completed your series. And so everyone who's 12 and up should have that booster dose on board. For those who are immunocompromised, having an additional dose, an extra dose, will help to get their immune system better able to fight this virus. And for a couple of months now, individuals over 50 and those with underlying conditions that put them at higher risk are eligible for another booster. And I would encourage them to talk to their provider about a booster. The Food and Drug Administration this week authorized boosters for individuals 5 to 11, and we anticipate our Centers for Disease Control partners and their independent reviewers to take action on that this week, and we may have that booster dose. In the future, I would anticipate that all of us will likely be getting an additional COVID-19 vaccine. When that is, and whether that's the current vaccine you've received or a vaccine that is tailored to new boosters, is not yet known, but our federal partners, our academic partners, and pharmaceutical partners are looking for the best path forward to protect us long-term.
Thank you for that question, Paulina. Our next question comes from Roman Battaglia with Jefferson Public Radio. Go ahead, Roman.
Hi there, Doctor. My question is, as you mentioned, we're hopefully nearing the peak of cases where we are right now and see higher hospitalizations, but I'm just wondering if there are any trends of increased cases in certain parts of Oregon where we're seeing higher amounts of cases, or maybe there are places where there are, lower cases. I don't know if that coordinates with vaccines or not, but I don't know if we're seeing trends depending on which part of Oregon people are living in.
I think some of the broad trends that we've seen is that increases in cases with this peak occurred initially in the Portland metro area and some of the more urban areas, and that has continued. Those areas are starting to see some slowdown, but we're still seeing some increases across the state. But certainly numbers will come down slower as they increase slower. So the Portland metro area, peak may happen sooner than other parts of the state, but there is significant spread of COVID kind of throughout the state, but we'll see different communities peak at different times.
Thank you for that question. Our next question comes from Mike Benner with KGW. Go ahead, Mike.
Thank you, Erica, and thank you, Dr. Sidelinger. Obviously, you've highlighted just how contagious this new variant is and the likelihood of all of us becoming exposed. I think what people are interested in, Doctor, is if you think we'll see any additional statewide mandates due to what you're sharing with us.
Thank you for that question. Based on what we're seeing right now in our data, what we're learning from other communities who are facing the Omicron subvariants, and what our modeling from our partners at OHHU state, I think we will make it through this current peak without having to take more measures that are mandates across the state. I think individuals can assess their own risk, their own health conditions, who they live with, and whether they're older adults, immunocompromised individuals, or folks at higher risk. They can look at what kind of activities they're participating in. Can they move those outside? How many people are coming in? And make decisions on whether to postpone those activities to a time when COVID is spreading less, or to wearing masks in those settings. We're not at a place where I think the cases we're seeing will lead to such an increase in hospitalizations that we're going to see limits on our hospital partners to care for all the patients that show up with COVID or with other conditions. So we really do encourage people to assess their own risk and the risk of their families and make decisions about having activities now, moving them outside, or postponing them altogether. I wouldn't anticipate additional risks in place on top of the mask requirements that exist in congregate settings and healthcare settings, and our current vaccine requirements for those workers in those healthcare and congregate settings, as well as K-12 settings, to try and encourage consistent in-person instruction. At this time, individuals are making decisions. We see more people masking up in certain communities as COVID has spread, and Multnomah County making that recommendation. I certainly see more people in the Portland area using masks in the previous days than I did in the weeks prior.
Thank you for that question, Mike. Our next question comes from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hi, thanks for taking my question. So I've got two. One, does OHA currently recommend that everyone in Oregon wear masks in public indoor settings? Why or why not? And then another question is, so after this COVID wave, what kind of, how will the pandemic look? What will it look like in Oregon? Like, what kind of waves and do you expect to see in the months and year going forward?
Thanks for that question. I would say right now we don't recommend that everyone wear masks in indoor places. But if you are not vaccinated, if you're an older individual, if you have underlying conditions that put you at higher risk, such as lung disease or heart disease, diabetes, or if you're immunocompromised and the vaccines that you had may not work as well, or you live with or care for someone in those categories, I would encourage you to continue to wear masks in indoor public places. In those 6 counties, including many of the Portland metro area counties where disease rates have risen to the medium risk level, certainly all individuals, I think, should consider potentially putting on a mask, even if you're not in one of those conditions. There's more COVID in the community, and the chances of you being exposed are even higher. But assess the type of activity you're participating in, your own health conditions, and who you're returning home to as you make that decision. And certainly many of us, may be more cautious because of what we've seen in our community and because of who are around. Some of us, won't be as cautious and won't be wearing the mask, but support your neighbors and the decisions that they make. And if individuals are wearing masks in a setting, that should be supported, whether that's at work or in school or in the grocery store. As for predicting the future, that becomes harder. What we're facing right now is a predominance of the BA.2 subvariant. We know that we've detected our initial BA.4 in Oregon, and we expect additional subvariants from the BA.4 and BA.5 subvariants to show up in Oregon. Those are slightly more transmissible than other Omicron subvariants, do not appear to cause any more severe disease, and we don't anticipate a significant change in our peak from those. As for what comes after that, it's harder to predict. I think with the level of immunity we have from vaccinations, including boosters, from recent infections during the Omicron peaks, and as people move outside in the summer, we're not likely to see sustained statewide increases in cases through the summer. But if new variants develop in Oregon, in other states or countries that come to Oregon, that could change. As we move inside in the fall, and as we move further from our current vaccination booster doses and from recovery from the Omicron variants, we'll have less immunity protection, and we may see even more disease in the fall, but it gets harder to predict the future as we move further out in the next few weeks and months.
Thank you for those questions, Fedor. We have one final question, it looks like, again, a follow-up question from Lillian with OPB. Go ahead.
Hi, thank you. I mean, given how much COVID is out there in the community right now and the lower severity of the Omicron variant, how crazy would it be for someone to just decide, you know what, screw it, I'm just going to go ahead and make sure I get this so that I'm on the other side of it? I know at the beginning that was obviously a really bad choice that you were advising against. Where would you stand now on that kind of question?
I would say our best protection against severe disease and the long-term COVID symptoms that come with long COVID is being vaccinated and up to date with our shots. There is risk with getting COVID even if you're vaccinated. There are folks who, even fully vaccinated and boosted, may wind up with severe complications acutely and need to be hospitalized. They may wind up with severe symptoms and not be hospitalized, but have to miss more work and have economic challenges. In addition, we still don't know exactly who is most at risk for long COVID. And so any infection with COVID could lead to long-term COVID symptoms. So what we can do to reduce our risk of severe disease, such as being up to date with vaccines, and then taking some common sense precautions when COVID is spreading fast in the community, such as wearing masks or moving activities outdoors or postponing them, is your best way to stay safe. Certainly any COVID infection is not without risk, even though a COVID infection in someone who's fully vaccinated and boosted brings a lower risk, it's not without risk.
Thank you.
And thank you for your attention. I know that there's a lot of anxiety in many parts of our community about COVID-19, but it's not the only thing that weighs heavy on our mind. As some of us are recovering from COVID, are dealing with the loss of a loved one from COVID, or are anxious about getting COVID or bringing it home to our children or an elderly relative, that's just one thing that worries us. Many parents now are struggling with worrying about feeding their children as baby formula is in shorter supply. We've seen communities and neighbors across the country who've been impacted by deaths that are driven by racism. And that idea of, can we still feel safe at the grocery store or at our place of worship when we go out, weighs on our mind. We know that there are other health scourges, such as the increased deaths due to fentanyl being more prevalent in the substance use community, and deaths being seen in adolescents and young adults is happening. There are so many things for us to worry about. Focus on taking care of yourself, thinking about those anxieties, having an outlet, someone to talk to, but realize there are things you can do to protect yourself and your family from COVID-19. Take the active step to be vaccinated and up to date with your vaccines, and consider wearing a mask when you're in indoor public settings when COVID is spreading at higher rates. And taking those active steps can help you protect yourself and hopefully reduce some of that anxiety as we move into hopefully consistently sunnier weather, warmer weather, where we spend more time outside and enjoy a beautiful Oregon summer, whether it's on the coast, in the desert, in the mountains, or in any of our parks and other areas outside. We should be able to do